Heat shock proteins are what we refer to as chaperones. When a newly formed protein comes out of its synthesis process, it's not structurally active and it has to associate itself with the Hsp90 or other client proteins, and then that makes it active, and then they can do what they do. So when you block Hsp90 with Ganetespib, what you're doing is rendering those new proteins inactive and subsequently they're degraded. So a number of key targets for lung cancer and other cancers that we've come to know about, like EGFR, ALK, HER2/neu, are all client proteins of Hsp90. There are more than 200 known client proteins of Hsp90, many of which are critical for lung cancer. So by blocking Hsp90, you're having a broader effect on a number of oncoproteins that drive cancer. And that's the difference between a drug like erlotinib that targets specifically the EGFR, or crizotinib that targets specifically ALK. This has an ability to target a wide range of proteins. The Galaxy-1 trial was conducted in advanced stage lung adenocarcinoma patients. We randomized patients to Ganetespib plus docetaxel versus treatment with docetaxel alone, which is the standard treatment as of now. And we looked at which patient group or subgroups may derive the most benefit that can subsequently be taken to a phase 3 trial. So that was the overall goal of the Galaxy-1 trial. And what we've seen is improvement in progression-free survival and overall survival for the entire population, but even more so for the greater than 6-month population, which is a time used to identify patients who have rapidly progressive disease versus less rapidly progressing disease. We found nearly 40% reduction in the risk of progression and death. So for the phase 3 trial, we're now going to be testing the drug in the most sensitive population, that's the greater than 6 months since the time of diagnosis. As it stands, this is the first randomized trial to document improvement in efficacy of a Hsp90 inhibitor in patients with cancer. If this holds up, the implications are wide. You can take this to other cancers. You can develop newer combinations with Hsp90 and Ganetespib and others as the backbone. So it has a wide range of exciting possibilities. But clearly, this is the first randomized trial for this group of drugs.